from participants. We'll be expecting feedback from participants. So in line with this now, I want to invite Mr. Kazeem Owolabi to give a welcome address. He's a trustee monitoring and evaluation from the Care Cancer Health Initiative. Thank you, sir.
Good morning, everyone.
Good morning, sir.
Good morning. This is to welcome each and every one of us to the much awaited webinar, which is purposely to address the topic that has been mentioned by our facilitator. And we have taken time to bring on board able speakers who are going to give us the best in presentation in relation to this particular topic. So we take this opportunity to welcome each and every one of us, and we fervently believe that at the end of the presentation, each and every one of us will have a better understanding of the topic and take this to the next level in terms of awareness. Thank you very much.
Thank you very much, sir. I will humbly want to call on Professor Air Commander Bashiru Adam Yakasai, retired, who is the CEO, Chairman, Dialogue Hospitals Limited in Northern Nigeria, Kaduna, Nigeria, to give us the opening remark. Professor, sir, the floor is yours, sir.
Yes, sorry, he's attending to the patient, so he promised to join about 5 to 10 minutes from now.
Okay.
Yes, so we can move on. Thank you.
Okay. Thank you very much, sir.
Welcome.
Another the professor is will join us in another 5 minutes, so we'll continue with the line of program. Mr. Joshua will give the citation of the guest speakers. Mr. Joshua is a team member of the Care Cancer Health Initiative in Benue State, Nigeria. You're welcome to the floor, sir. Mr. Joshua. Mr. Joshua.
Perhaps I stand in for him while in the interest of time. Can I stand in for him in the interest of time?
Go ahead,
okay.
Sir. It's welcome.
Okay. It's my pleasure to welcome every one of us on behalf of the Board of Trustees of Care Cancer Health Initiative, as well as Consciousness Cancer Initiative, KCHI and CCI, to have our distinguished facilitators as well as guest speakers in our midst. So on the Board of Trustees as well as the management of the two organizations, we are happy to have you around, particularly the president of the Nigerian Cancer Society and the entire NCS team. We are very happy to have everyone on board. Dr. Anatu Ayuba Usman, she's a senior registrar in the Radiation and Clinical Oncology Residency Program at the National Hospital, Abuja. She's a very passionate oncologist in residency training who does the science of caring for all cancer patients as well as an advocate of cancer. She's an enthusiastic global health scientist with cancer research, cancer prevention, health promotion, health systems strengthening, and community oncology at heart. She has organized several programs in the past and currently organizing several other advocacy and intervention campaign programs. Of note is the screening of women from 17 local government areas, as well as in the country. And she has published in renowned journals, both national and international publications. And I've also presented at different scientific opportunities. So our effort also led to the incorporation of Cancer Consciousness Initiative, CCI, and she's also one of the Archon Jackson Prostate Cancer Research Seed Grant Mentoring Program awardee for the research on the prefactors diagnosis in prostate cancer patient undergoing care at the national. So it's our pleasure to welcome Dr. Notu into our midst. Our presentation will also be supported by that of Dr. Ahmad. She's also registered in the very prestigious Ahmadu Bello University area. BS now. Thank you.
Thank you very much, sir. That was a very beautiful citation from Igboika, very exciting. And with this, it sets the background for a very exciting talk this morning. I'll welcome, right now, welcome the speakers. Dr. Ayuba Anatu. Hello?
Hello.
Hello, can we?
Hello, can you hear me?
You can hear you.
Can you hear me? All right. Good morning.
Good morning.
Yes, morning. Joining you this beautiful morning to discuss bone cancer, to increase awareness in all our different communities. Thank you. It's humbling listening to all that you have said. I'm very grateful, and we look forward to working together. So can we share the slides now so that we commence ASAP? Thank you. Dr. Mamman will start with the introduction, then I'll take over from her at the prevention detection. So Dr. Mamman, the floor is yours.
Okay. Good morning, everybody. Sorry, the slide is not up yet. Or should I continue?
Good morning.
Good morning, ma.
Yes.
Yes, Iowa, now, can you see the slide? Can you see the presentation?
I can, but it's not on slideshow.
About now?
Okay, yes, it is. Thank you very much. Good morning, everybody. Thank you for this particular, like every other cancer, it's what being aware of to help in early diagnosis, and so that we can have early presentation so that it can be attended to on time and also improve the results. giving us favorable results at the end. Next slide, please. For the purpose of this webinar, we'll be going through this outline. Next slide, please. Okay, we'll be going through this outline. I'll briefly go through introduction, epidemiology, risk factors, the various types of bone tumors, what signs and symptoms should we actually look for so that we can quickly present to the hospital on time, and then we'll be going through the various cadres of prevention so as to improve the outcome of this disease. Next slide. So as a way of introduction, it's important to know that the adult human body has about 212 bones, and surprisingly, even in younger children, we have more bones than this. And then when we talk about cancer, it refers to a class of diseases in which we have abnormal cells that begin to divide uncontrollably, and they usually have the tendency to move to other organs in the body. These cells suddenly begin to divide uncontrollably as the result of various factors, which some will be highlighting during the course of this presentation. And when bone cancer develops, bone cancer develops when cells within a bone now begin to divide uncontrollably, usually forming a lump or a mass of abnormal tissue within that region. And tumors that originate primarily from the bones are referred to as bone tumors. It's important to know that now, when you have a swelling, bone tumors could either be benign, meaning such swelling or such tumors do not have the tendency to spread to other organs or locations in the body, or they could be malignant, meaning they have the tendency to spread to other parts of the body. So when it's malignant, is what we now actually call the bone cancers. And even of tumors that have been termed bone cancers, it's important to know that some swellings or bone cancers are actually from other sites, meaning probably these patients have cancers like probably cancer of the breast, cancer of the prostate. Then some of these abnormal cells from the initial sites like breast or prostate begins to deposit in the bones, and it will now lead to what we bone cancer. But in such cases, we call it metastatic bone cancers. Next slide, please. So this is just the structure of one of the 212 bones in the body. Actually, this is the longest bone, which is the femur. Is the bone located in the part of the body that we call the thigh, where we put our babies on when we carry them. So we have different parts of a bone. Next slide, please. We have different bones in the body, and the bone has various functions like those, of which one is support. Just like I said, I showed the picture of the longest bone, which is located in the thigh. Bone helps to give us support. It's because of the bones in our body we are able to move. It helps to give, it's more like the framework of the body. The shape of our face, the cheekbone, is as a result of the support given by movement. So protection of vital organs, like we have the ribs, which are located in our chest. It helps to protect vital organs like the lungs, the heart. We also have our skull, which protects a very important organ, the brain. Also, among the function of the bone is it helps to store important minerals such as calcium, phosphate, magnesium. There are a huge chunk of these minerals are stored in the bones. Then bone also helps in the storage of other growth factors and cytokines, which are necessary for our body development and other normal body functioning. And it's important to know that a large chunk of our blood is actually being formed from the bone marrow, which is also an important part of the bone. So we have the red blood cell formation that occurs within the bone marrow of the bone. Next slide, please. And a huge chunk of the primary bone tumors are actually benign, meaning they do not have tendency. A huge chunk of them do not have tendency to move to other parts of the body. while just a few have tendency to move to other parts of the body. That's the malignant bone tumors. And even of these ones that are malignant and can spread to other organs, only a very few also occur primarily from the bone. A huge chunk also from other prostate. Malignant bone, when they occur, people are usually age specific, meaning to the fact that between most times the form of bone cancer they have you sarcoma, and you see a patient that's above physical next form of next is the osteochondritis. Joint located towards the distal end of the femur or the proximal part of the tibia. And according to the Abuja Cancer Registry in the National Hospital Abuja, we recorded about 23 cases of bone cancer in the year 2022. And Alegi et al. Also discovered that we have period usually within the time of onset of symptom before patients eventually present to the hospital, which is 10 months is actually a very long time and a lot of, and 10 months is a long time for all disease before it gets out of hand, which is why to help enlighten the public on the importance of early what to look out for so that we can detect it on time. Also globally, we have the month of July has been marked down as the bone awareness. Next slide, please. Factors, what predisposes individuals to this type of cancer is broadly classified into risk factors that are preventable, that is something we can control, and those that are beyond our control, which is referred to here as the unmodifiable. Familial conditions, familial syndromes refers to conditions that occur usually like in family. It occurs in one relative, and the tendency of it occurring in other members of the family is also very high. Example of which includes things like the Li-Fraumeni syndrome. Please do not be intimidated or bored by these names. They are just conditions that occur and are not necessarily important for us to know, but it's left for doctors to worry about them. That's the Li-Fraumeni syndrome, hereditary retinoblastoma, the Roth-Thomson syndrome, the McCune-Albright syndrome, the Werner syndrome, Bloom syndrome, Diamond-Blackfan anemia. We also have when patients or people have prior bone diseases, like people that were given birth to with bone anomalies, they're also at risk of coming down with bone tumors later in future. When an individual also have a Paget disease of the bone, it also increases chances of coming down with bone tumors. Then also other bone abnormalities such as solitary or multiple osteochondromas, solitary endochondromas, endochondromatosis, and fibrous dysplasia. There are also bone conditions that predisposes one to the risk of bone tumors later in future. And also, when you have a family history of bone cancer, the risk of one coming down with bone cancer also increases drastically. This next slide. And in patients that have had cancer, following treatment, like patients that have had leukemia or lymphoma, following treatment with bone marrow transplantation, this procedure also increases the chance of coming down with bone tumors later in future. Also, when they receive alkylating agents like anthracyclines, also increases the risk of coming down with bone tumors later. Which when a patient also receives ionizing radiation, that's like radiotherapy following cancer or other reasons, it also increases the chances of coming down with bone cancer later in future. People that have had prior internal fixation, like following bone fracture, and they have internal fixation to probably correct the bone anomaly, they're also at risk of that. Now, when we now come to the risk factors that are preventable, exposure to ammonium salt, beryllium oxide, asbestos, aniline dyes, people that work in factories, people that work in radio rubber factories, people exposed to herbicides, farmers, wood preservatives, vinyl chloride, that's leather manufacturing companies. These are chemicals that predisposes to bone to osteomyelitis. Only two bone, it should actually be attended to appropriately by qualified individuals to prevent it progressing to things like chronic osteomyelitis that could eventually predispose one to bone cancers. And also prior sites of bony infarcts, sites of metallic prosthesis too, are also risk factors that could predispose one. Then when you have an individual that is or taking alcohol, they're also at risk of bone cancers. Please, next slide. Okay, like saying primary bone tumors, we have the benign, the malignant. The benign are bone tumors that are restricted to just the site at which they started, and they do not have tendency to spread to other sites. Example includes things like the osteoma, osteoblastoma, osteoidostoma, osteochondroma, giant cell tumor, also called the osteoclastoma. Then we have the malignant bone tumors, which are bone tumors that have tendency to move to other locations in the body, either moving to other bones in other sites, or they're even moving to other organs that are not even bone. Example, sarcoma, Ewing sarcoma, chondrosarcoma, fibrosarcoma, malignant fibrous histiocytoma, chordoma, malignant giant cell tumor. Next slide, please. Now, what signs and symptoms, what should we actually look out for? So that when we see these signs, we begin to run to the hospital so that such conditions can be attended to promptly. When we suddenly have a lump or a mass in a part of the body, like we can see this patient has a huge swelling in the leg. There's another one on the back of the other patient. We don't necessarily have to wait for it to be this huge. But it must even be bigger than this. So when we have an abnormal swelling or a lump in any part of our body, when if for no reason patient comes down with what we call pathologic fracture, there was no cause, but the bone, we had fracture, meaning the bone breaks. That's called fracture. So when it occurs, to those are also signs of bone tumors. Presence of fever, that the body is hot with cold, would also be part. Then we have such that blood, low hemoglobin concentration in the body. That's when they'll tell you your blood level is low. It's also a sign that could occur. Then anorexia, your loss of appetite, you're not eating, fatigue, you're just weak, and generalized body weakness. Then also presence of weight loss, usually unexplained weight loss. It's not like you are on a diet to reduce weight. But so next slide, please. So now, having talked about things that could predispose one to this condition, I would have also spoken about signs and symptoms to look out for. The next step would be to analyze steps to be taken for early detection, steps to be taken to prevent bone cancer, topmost of which is early detection. Next slide. For the prevention, we have different stages. We have the primordial or the primary prevention, and this includes it's aimed at just avoiding the risk factors. That's the preventable risk factors. We are avoiding them so as to drastically reduce chances of coming down with these bone tumors in the first place. Measures to take include things like eating healthy, wholesome, natural food and balanced nutrition, engaging in regular and realistic physical activity,
So I'll
see. Necessary in either in the home, public spaces, parlor and joints. Also, prevention of exposure of young children and teenagers to chemicals and dyes and herbicides. Also, limit the use of alcohol use. Sorry. Abstaining from or limiting the use of alcohol use. Ensuring sleep hygiene. Avoiding unnecessary stressors in the environment. And also need to know our
Participation.
Sorry. Can I continue? Okay, we also need to know our family. Okay. So I'll be stopping here for my other colleague to continue so that she'll take us through prevention. Thank you.
Thank you very much, Dr. Nafisa Mama Mohammed, for that very insightful, beautiful presentation. You really used very simple terms and you were able to carry a lot of persons along. Thank you so very much. Dr. Ayuba Anatu. Dr. Ayuba.
Hello, can you hear me, Dr. Maman? Hello.
Yeah, we can.
I can hear you. I can hear you now.
I can hear you, ma.
Up to the detection slide. Dr. Maman, well done with the presentation.
It was a beautiful one.
I'll be taking on from the prevention, the early detection. Looking at those images of the hand swelling, the back swollen in the young man, these are all signs and symptoms that family members, relatives will see in some of their family members, and awareness of the disease and how it presents is the first step to early detection. And early detection gives better outcomes. So when this disease is caught early and managed early, the patient outcomes are always better. The 5-year survival of osteosarcoma is about 76%. This means that an individual who has osteosarcoma and has been treated early has the chance of living up to 5 years, just like a normal person living in the normal population has a 76% chance of living like that normal person in the population. And that is why such avenues like this to raise awareness about how these diseases present is important. This is a way that when people see this, it reminds them of 1 or 2 lesions, and then they will kindly advise their loved ones to present to the hospital, and not just any hospital, to the specialists, to those centers that have these multidisciplinary teams available to manage these conditions. So there are no population-based screening tests for the detection of primary bone cancers. However, in patients with hereditary multiple exostosis or bone abnormalities, or those individuals with family history of bone cancer, these individuals are at high risk and they benefit from plain radiograph x-rays, which are done yearly, or limited skeletal survey of the involved areas, which should be considered either yearly or 2 yearly. However, this is at the discretion of their doctors. They are advised to see their orthopedic doctors who will advise them on how to follow up. Next slide, please. So looking at our public health parlance, prevention is at different stages. At the primordial and primary prevention stage, we encourage that the population, general population, should all eat healthy, wholesome, natural foods. We should encourage balanced nutrition, as balanced nutrition is very key. We should not be starving ourselves, because there's a lot of health information online. So we should make sure that we are informed. We should all engage in regular and realistic physical activity. We should also prevent exposure to cigarette smoking. And this is no spaces, even in the home. In the homes, we should discourage teenage smoking. We should discourage children going to hookah smoking parlors, parents smoking in the house, and with children exposed to smoke. We should also prevent exposure of young children and teenagers to chemicals, dyes, and herbicides. We understand times are hard. Many parents feel that children should go and learn mechanic, they should go and learn trade. Is important. However, children should not be exposed to chemicals, because these cancers are common in children. Their bones are fast developing, and it increases the risk. We've seen many cancer cases, bone cancer cases of children that their parents had sent them to learn the mechanic trade. Then we should abstain from, or small, or for those that have to take alcohol, they should limit alcohol use. We should ensure sleep hygiene, ensure that you remove unnecessary stressors and toxic situations and people from your life. Know your family history is very important. Have bone cancers or other cancers. Do not ostracize patients and their relatives, because having to know the health, is a very, very important history. Prevent history and studies have shown radiation had children who developed bone cancers. It starts from the history of that bone pain, that bone swelling, history cancer. All this information is important. Then the physical examination, which will be carried out by the health professional, and then blood investigations. These blood investigations are in different types: the hematology, the metabolic panels, that's the kidney function, liver function tests. All these tests are done. Then the imaging. Many times you see people in the grassroots with X-ray films. Imaging is the radiology investigation is common, so many people may have one or two complaints and quickly go for an X-ray. It's important. These are all important in coining and bringing out the diagnosis. So radiological X-rays, bone scan, this
No, every day, yeah. I said I want to.
Hello. Good afternoon, Peter's hand. Dr. Nafisat, can you hear
Yes,
me?
I can.
I think you can continue from where Dr. Anna stopped. It seems
Just
good.
spoke to her. She said she's trying to join with another network. So maybe if you give her a minute and she doesn't join, then I can just continue.
Okay, because our time, we just have 15 minutes to.
Okay, so maybe I start, then when she
So,
comes online, then I'll stop.
I think so too. You can start from where she left off.
Okay, I think
People do radiographs and forms of early detection, prompt
yes,
diagnosis.
all right. Just like gets into the bloodstream, they are taken up by these tumors. So sites that have these tumors will glow because after the patient is then scanned. So it's this picture that you have. So you now have that the sites of bone tumors are the ones that will be very prominent, like those highlighted by the arrow. Then you also have other imaging like imaging options like the magnetic resonance, position, like okay, and easy to pay there you procedure and take issues. So it's based on is the pathologist now that will now analyze these cells through various procedures, and they will now be able to tell us then even under the ones that are already known as malignant, it will be able to tell you based on features seen under the microscope. This is this particular type. Like I said, we have the Ewing sarcoma, we have the chondroma. So all those different types based on different analyses by the pathologist will be able to know which type. Next slide, please. Okay, sorry, the slide before, the management slide, sorry. And just like I said, while explaining, I've already made mention of the pathologists, I've made mention of the
Yes, we encourage patients to present at hospitals where the biopsy will be taken at the same time where they will have the chemotherapy and the surgery, because it's very important that even the scar from the biopsy procedure to be involved when the definitive surgery is going to take place. Different specialists are involved in the management of this special therapists, facial surgeons, the prosthetist, radiologists, medical oncologists, and many other specialists, depending on the site of involvement of the disease and other comorbidities. Also a multimodality management, in that it's not just surgery alone or chemotherapy alone. Surgery, radiation treatment, chemotherapy, and targeted treatments. Now there are so many genetic profiling tests that are being carried out on bone cancers that enable targeted therapies to be given, immunotherapy to be given, and this is very important in the care for bone cancer patients. Patients with bone cancer are beginning to have better our palliative kind of treatment. However, we encourage that early detection and then people coming to the hospital will be able to give the opportunity for